Okay, this is, I'd like to call the Health and Human Services Committee meeting to order. I'm filling in Elaine Daly for Heidi Nightingale, who can't be here today. Also excused is Brian Muldrow, and with me today is Bob Shea and Tom Winslow. I'd like to ask for minutes to approve the April 9th minute.
Second.
All in favor?
Aye.
Great. We do have one appointment on the committee agenda today, which is a Sumner Young, an unexpired term of Jonathan Lane. And we're asking to appoint him to the Mental Health Subcommittee of the Community Services Board. So I'm sure that will come at the ledge meeting as well. So at this point, we do only have 5 resolutions tonight. So maybe we could start with Kathleen Cuddy, because you are HH1 anyway. So do you want to go over, let's get the resolution out of the way. Authorizing the chair of the legislature and the public health director to enter into a 2-year agreement with New York State Department of Health to allow the health department to continue to participation in the rabies program. Can I get a motion in a second?
I'll move it. I'll second.
Okay, looks like the same level of funding.
It is. It has not increased, but we spend it all.
Okay, and this is mostly human rabies or for the SPA clinics
Correct.
as well?
It's, yes, we can use it for the required, at least 3 times a year rabies vaccination clinics.
Okay.
There should be no charge to people for their dogs, cats, and ferrets who are domesticated. But primarily we use it for a lot of the testing of specimens that go in.
Okay.
And rabies vaccination shots.
Okay.
Rabies exposure shots that people have, whether it's the rig or the vaccine.
Okay, and any other questions about accepting this money? All in favor?
Aye.
Great. Okay, Kathleen, do you want to add anything to your update?
Yes,
Chair,
Yes.
is this an acceptance of funds?
It is. It 2,620.
This is an agreement. I didn't.
Yes, it's 26,618. An estimated grant award for each 12-month period on this 2-year contract. So, yep.
Great. Thank you.
26 a year. If you don't mind, I had a handout that I just wanted to hit some highlights, so I brought a hard copy.
Okay.
And then just a couple other updates that I'll share with people. The handout that I'm giving you thought was a very interesting one that our state health organization put together for us. And it really shows the hits that local health departments have taken over the last, nearly 2 decades, 15 years, where there's been tremendous loss of staff, reduction of staff, low sale, in part, they believe, and this is based on surveys that are responded to by each local health department.
So this is not funding to the department, it's staffing in the department.
So it's investment in local public health departments, investment in our communities. So where there's money put into local health departments, right, it makes communities better. But we're saying that there has been a real loss of reduction in staff, and some of that is due to planned retirements. There is a declining full-time workforce, and we understand a lot of times why counties do that, because there are costs associated, but it's significant when you only have temporary staff and to invest the time into orienting them. And it also makes note of salaries making recruitment and retention a real challenge for local health departments. And you'll see the graphs of staff reductions that have happened over time, full-time, part-time, certain jobs that are more challenging to fill. And we're considered a medium county. So on the flip side, when you see, needs for medium-sized communities, we can see that there really is a dearth of skilled employees, oftentimes, or as we certainly have seen within our own department, right? We have a vacancy. We might have permission to fill it, but it takes a period of time to try and identify someone who fits those skill sets in order to perform the work. So I thought this was just a really well put together graphical analysis of information. There also is an enumeration study that provides a lot more information. And I'm getting some of the numbers that are specific to Cayuga County that we submitted over time, which I think certainly will be of interest to me and our staff, but I think can be very
That will give us what
eye-opening
information?
too.
I'm lost.
our actual staffing numbers in certain categories and where they've gone up and down over the years at a point in time when we do that study.
Just a dumb question, or is?
No,
You report to the state health department all of your staffing patterns, and so
No.
they know what has happened in Cayuga County year after year? I'm
no, it's
confused.
the State Health Association, SHO,
Okay.
does a survey
Of
of local health
Okay,
departments.
okay.
And we answer that, and
Okay.
SHO
Puts this
analyzes
together.
that.
Okay, all right, that makes
Yeah,
more
state
sense.
health,
No,
No.
okay, all right.
they're having the same issues really a lot of times. I'll speak to the updates in state and federal funding in just a minute. We'll talk a little bit more about something a little more fun. One of our more public facing events that gets a lot of positive attention because it really engages school children, school districts and young families is our Bike to School, which is an injury prevention and physical education. We have had that last week and it's finishing up this week. All 5 of the elementary schools in the Auburn district participate, as well as 4 of our outside the city school districts, elementary schools. So Millard Fillmore in Moravia, Weedsport Elementary, AA Gates in Port Byron, and AJ Smith in Union Springs. Cato and Southern Cayuga are so very rural that it's not a realistic expectation that children would be able to ride their bicycles to school. Just as an example, weather certainly plays a factor, and last week was kind of less than ideal weather, but there were participants at every school. Just yesterday in Moravia, we had 147 children. If you can, 147 children rode bikes to school, which is amazing. That's
Yeah.
and it's really positive, engaging program. So it's good to be able to talk about that. We're putting together a lot of information on vector-borne disease information to go out to the community on mosquitoes and ticks because, with warmer weather, wetter weather, we see a lot more of this and they are disease-carrying agents. Giving you an update on our environmental health division and some of the work we're trying to do in anticipation of some temporary but lengthy vacancies. We did get some bids bids is the wrong word. We did get some interest from engineers to contract. And so I think we have about 3 or 4. So we'll be having a Teams call in another week to talk about some of the administrative aspects with those interested parties. And then we'll have an in-person session to meet with them and kind of go over, here's the actual work that needs to be done. And here's the Cayuga County, regulatory stuff and who you speak with and where you send it to, and et cetera, and what our plans look like. So that we'll have, ideally have some options for doing our septic inspections and water treatment inspections, water system inspections as may be needed. Where we are not having success, and I will ask any of you and all of you to spread the word and get the word out. Sending letters again. We had sent things through our purchasing agent. We sent them as a separate email through our rabies coordinator. We're sending some hard copy letters today, and we'll do another round of emails with a different subject line. We need to have some rabies specimen preparation people. We do not have any. We had no interest yet. It's not a glamorous job, but it can be a decent paying thing that someone can do on the side. And hopefully this letter that we send out will go to veterinary offices as well as to those DEC wildlife specialists who qualify. And that's on a DEC website. We don't have hard addresses, for the DEC wildlife people. So we're going to see what we can do to get some addresses to also mail a paper copy, because my fear is that sometimes things just go into a junk email. But I say this in the hopes that word gets out, via YouTube, and word gets out from the people here. We need to contract with rabies specimen preparation people.
And there is a minimum training, or there is a minimum requirement. Didn't you say that before?
Correct.
Which is?
So it is these wildlife people and it's these vets that have it. You have to be certified in using the euthanasia products and then be able to, and there's a level of universal precaution that comes with that, right? But we also need people to go pick up the animals in order to bring them to their site for the preparation. So there's a few steps involved, but as we're sharing with people, they can bid on the parts that they want to. If they only want to do bats, fine. We'll contract with you to do the bats. If you only want to do the animals, great. We'll contract with you to do the animals. So
Do you know how other counties manage this?
we've talked to like 5 different counties and it's all over the place. Some people, one county, Onondaga, does it themselves.
Oh, because they couldn't find anyone to do it?
Well,
Potentially, or?
I didn't ask why they choose to do it that way, but they have a few people who are full-time employees and that's their job. Another county contracts with Cornell Veterinary Lab. Well, that's a possibility for us and we can certainly look to do that. But we still got to find a way to get them there. Right? And that's not something that I foresee our staff doing because we aren't trained in that type of precautions. And someone should be vaccinated against rabies before they start this work.
Do you know who picks up dead animals on the road?
Uh,
I mean, does anyone, how do animals in the road get picked up and removed? Or who does that, or no one?
Highway departments too.
I don't know if highway departments do, or towns and villages, or
Probably put on a pair of gloves and chuck it.
Yeah.
Yeah. But maybe that's something, right? If you have a garage or a place where you want to do the specimen preparation we can put you in touch with people who do this for a living. If it's something that someone's interested in getting certified for, we'll certainly try and share that information also. But we were looking to contract with people who already possess this certification.
I don't know.
That-
Go ahead.
oh, sorry, that actually is a good question,
Yeah.
because I'm thinking back, I did have somebody ask me once, because there was a couple of dead deer, and how do we get these taken care of? And honestly, I said, I'm not sure, maybe the town has a way to do that.
I know the highway department's not a fan of that, they're responsible either, right? Right.
Like Kathleen says, if they're not trained and have the right vaccination or whatever against whatever they want to be handling, I wouldn't want to be handling an animal either.
I probably wouldn't, but but I'm not the biggest animal person anyhow, but at least with these people, with these animals though, there's reason to anticipate that they could be infected, which is different than a car hit a deer, right, on the side of the road. Nonetheless, you don't want to expose yourself to potential pathogens. So you definitely should be at minimum, be wearing gloves. Yeah.
But the message is, anyone interested in any component of this process?
Call the health department.
Okay.
We'll be happy to talk more greater detail with people and get additional information.
A couple of things,
Yep.
maybe a smart, and this is just a proof.
Yeah.
It is, maybe we could establish some holding facilities and ask, when the time is appropriate, ask Cornell to come out and do the sampling. Might be more, rather than us handling.
I don't disagree with you.
So that,
And it's certainly worth inquiring. The county that we were familiar with did have people who they had a county pickup truck where they, but the other issue could be too, sometimes the animals are not, they're in a cage, they're trapped, right? Or
right.
they're not already dead. And then if they're dead, there's a time element to have them.
For the brain to be, yep.
It's not perfect.
Yeah.
My second question, Madam Chair, is, for lack of a better term, the proposals that came, or proposals of interest that came through, did they have any cost on them?
For the engineers are the only ones that we have interest on, and that was they were all within or below what was in our resolution.
Okay, but they're all around the same cost, but, okay. Awesome.
Yeah.
Thank you.
In small counties or counties that don't have a engineer on staff, do this work by contract all the time?
Other counties don't have the septic system law that we do.
Right,
So they don't need an engineer as often. So for some of their water treatment, they would contract out.
yes,
for water
but we
treatment
have additional work because of the strict sanitary code we have.
Correct. Right. So actually, to your point, maybe I'll send out the letter that we're sending to all the legislators that gives a little bit of information about.
Yeah, they might.
Prep, and that would be helpful. Great, thank you. And then I wanted to give you a little bit of updates on some of the budget information that we have. So I'm just going to read from some of the highlights. Last week, as you all know, the state budget passed. And from a public health perspective, we're in good shape, right? I'm going to read a few of the highlighted aspects I have here. Of particular note is language in the appropriations bill that will allow the governor and director of the Division of Budget to propose and withhold funds mid-year, with the legislature having a limited 10-day window to respond and propose alternatives. This language reflects concern over the impact of potential loss of federal revenue, as well as any broader changes to the economic climate which may affect state revenues. So no secret, right? They're saying we're passing the budget, but if we have to come back and change things, we reserve the right to do so. Article 6, funding has remained flat, which is, we always ask for more, but at least we didn't lose any.
750,000?
Correct. That's the state aid grant and the 36%. Outside the health department, there was an increase out of classic health department. There's an increase to the 4410 preschool funding. However, that increase reflects the funding of the current state share of reimbursement. So the local health departments will not see an increase in that. The capital projects budget continues to include $20 million for lead abatement for the Leading in Lead program under the Division of Housing and Community Renewal for grants to landlords in the designated communities of concern who will need to comply with the lead rental registry program starting in November 2025. That impacts us. So we will have ongoing funding for the Leading in Lead program, which we're just getting off the ground right now. We are working with a subcontractor, and this program is for landlords who have units that need replacement of windows and doors primarily that are friction sites. But there is buy-in from the landlord because they have to fix all the lead problems. The goal is to have an apartment unit lead safe, lead free, right? So that if there's lead paint on the wall, the landlord's going to have to paint the wall or do whatever they need to do. I'm saying. But if it's replacing a window to get a sash in the sills and such, there's money to help offset that cost.
So the hook for the landlord is we'll give you funding to do some of these things, irregardless of whether you're renting to small children or you're not.
Correct.
You just have to, and that's who has to be on this registry, or we?
So everybody who's a property owner of I believe it's a duplex or more.
Okay, 2 or more units
Yep.
that are landlords and
Correct.
have to, by law, have to be on this registry.
Correct.
And you'll find them somehow if they're not?
Well, the state's supposed to be giving us
Okay.
a database that
Okay.
says that. I think
Yep.
the city has an idea
Okay.
of many of them. We have an idea from some of our experience of many of them. But yeah, that's going to be part of the people who we eventually will have to hire to work in the lead registry program to help identify how to get the word out to people.
And the expectation is in November, you'll have a functioning registry.
That's our understanding.
Okay.
But it's really this leading in lead, this lead replacement is such a great opportunity for people. And we are prioritizing, it is the health department that is working with Home Site to prioritize apartment units that do have children in them. They get first dibs at this money, and if they are willing to partake in it, but it is not restricted to apartments they have
And
children.
you may not have enough money for everyone on this registry, so that's where you'll prioritize.
Right. We hope that there'll be a run on this and so many people who want to take part in it, that we tap out of money and can ask for more if they have it. Yeah. So that's good news. The clean water infrastructure funding remains at level funding, so that's good news. Two changes, this just kind of a point of interest, two changes that are part of the final adopted budget. The Office of Gun Violence Prevention had been in the State Department of Health, and now it's going to the Division of Criminal Justice in New York State, and the expansion of school lunch programs to a universal free school lunch program. Yep, they talked about amending. All right, how the state is working on budget as it stands until they know any federal differences. And then we've got a little bit of, some of the specifics of public health funding and for programs that we operate. So far, it looks very steady. So we'll take that.
Yep.
Any other questions?
No, appreciate the fact that you're this leading and led the registry, you're contracting some of that work out instead of, in asking for additional in health department staff to do it. So I appreciate that.
Yes, thank you. All right.
Okay. Chris or Jennifer, you're here for Christine's out on medical leave or?
Yes.
Okay. You have 3 resolutions, right? Oh, it skipped right over Lauren. Sorry, Lauren. Okay. How about if we can go through, HH 2, 3, and 4. We'll move them as a bundle and then we can ask questions on any of them. Okay, social services 2000 budget to accept funding for the rental supplement program, which we can talk about after. The second, HH 3 is authorizing the Commissioner of Social Services to fill a caseworker vacancy in child welfare. Authorize the chair of the Commissioner of Social Services to renew a contract with Rescue Mission for homeless family and transitional housing. Can we get a motion for those 3 in a second?
I'm moving.
Second?
Okay, and if you want to go over,
Sure. So the first resolution is to accept funding for the RSP program, which is the Red Supplement Program. This is the second year that we've been awarded this money to utilize. The fiscal year started April 1, so they just gave out the allocations in the last couple of weeks. So we would like to accept the money. We currently have 9 households that we're subsidizing. And we have enough funds that we could probably do about 20. So we are working towards that. The barrier to getting the families is finding affordable housing. So they have to find the housing first and then come to us, and then we can set up a Red Supplement for them.
but without supplementing them using this $268,000, without a supplement, sometimes the shelter allowance is so low, you can't even go there.
No, not even possible.
And these will help families, singles,
Both.
Okay.
Both.
You would use this pot of money to say, they come and say, I found an apartment, I can't afford it on my public assistance payment. I need some supplement, and you can do it for a period of time?
We can do it until they are sustainable. So
Which
it's
means,
ongoing.
great, find a job now and increase your
Yes.
income, and that's kind of the goal.
Yes,
Okay.
yes. It also helps with, we can pay for rental arrears. So before somebody gets evicted, if they come to us and they have a place and they have like 2 months that they need to pay before they're evicted, we can do that and then move forward as well.
Okay. All right, could you go over
Yep.
HH3?
HH3 is to fill a caseworker position. We currently have 7 caseworker openings. This is just yet another one. This is included in the 7. We had a worker who left to work in Onondaga County for a legal firm.
All right.
And the third is to enter into a contract with Rescue Mission. They provide 8 units for transitional housing for families. So this is actually all TANF money. So we are reimbursed this amount of the contract. They did not increase it from last year at all. And we do have all of those 8 units full.
Even though some are one bedrooms, they're still all for families?
They're all for families.
Okay, that's why it's totally 100%.
Correct.
And the goal is to not have them there for 90 days and then have them homeless?
The goal is to not have them homeless. They work with case management while they're there to try and find them an apartment or a place to stay so that they don't revert back to a hotel or.
Okay. All right. Is there any questions about those? All in favor?
Aye.
Aye.
Can I do just a little bit of an update? Okay.
Sure.
First, I just want to say thank you to all of the departments that have housed the staff from the Department of Social Services for the last year. We're so grateful that they opened up their doors. I know that everyone here has displaced their own staff to add our staff in, and we're very grateful for that. We are moving forward with 63 Genesee. We do have some staff who are already working there now. We started moving in phases. We started May 1st. So we have administration there now, our accounting unit there now, as well as daycare. And tomorrow we are having some of our services staff move into the building, and hopefully by the end of the month, we'll have everybody there. So that's good.
Everyone, but not all services staff.
Everyone who we have space for will be
Okay,
there.
all right.
Yes.
Yeah.
That's an answer.
Yeah.
Can I ask how many that is? How many workers are going in now? You know,
To be honest with you, I don't know the exact number, so I don't want to tell you the wrong thing.
roughly.
Maybe 80,
80, and we still have another,
130, 140.
not,
No, I'm sorry.
Oh.
I'm sorry. Total, we have 140 staff.
Yeah,
Sorry.
so the building is going to have 80 Department of Social Services staff, base guesstimate, and as well as the finance staff, as well as
The treasurer.
the treasurer. So it's not all for DSS.
Correct.
Okay.
Correct. It's not all for DSS.
and we still have 40 plus or minus remote. Is that my understanding?
They will be.
Or displaced?
Well, are you going to keep case integrity in a place but not there?
Yes, so
Okay.
we do, yes, and as well as our social services attorneys are going to be at 2 state. So that unit is going to be there. On that note, we do have a paralegal specialist starting at the end of the month, which is great. And we do have a social services attorney who also has accepted a position and is going to start in July.
That's great.
So
You were great. I mean, that's,
huge,
mhm.
huge.
Yep.
Back to you though. Case integrity is going to remain at the highway department.
So
And-
is your question, how many after all is said and done may be working remote?
No, my question is, I wanted to know the capacity of the building.
Okay,
How many were able to get in there? And because my understanding after the fact is that not everybody, there's not a space for everybody. So I want to know where we are. And it looks like we've housed like 2/3 of what we have.
At 63 Genesee, yes. But there will be some of our staff that are housed in other county locations. And then there will be some that are still remote.
Okay, and I'm getting it. So the issue is not completely resolved, but it's better.
It will be much
Fair enough.
better,
Okay.
much better. Yes, 100%. Other questions about that? I just wanted to also just update you. You usually want to know about the homeless numbers currently. As the census of last Friday, we had 104 singles and 31 families. That is down. Now that Code Blue has ended, the warmer weather, it's down a little bit, and we have been successful with getting in, I believe it was 7 households into permanent housing at the end of last week. So that's moving in the right direction.
and I think both of you must, if you looked, have seen that Jen's office had sent out some dates for potentially a get together. Because as you know, we had some conversation about, the vandalism in the hotels. Then we had conversations about what's actually making up single individuals who've been in hotels for 6 months or longer. And Jen, we all agreed it's worth taking a look at the profile of those cases. And if there is a way that we could put our heads together, I know the sheriff's interested in some of that with some assistance. We should get around the table, discuss it all, and see if we can impact this in any way.
Yes,
And, you're going to bring that data. You're also going to bring some data around the costs over the last couple years. And we'll just have, a very frank conversation about, what is this population and is there anything we can do to move this needle?
And how many families did you say?
31.
31, thank you.
So 104 and 31, it is less than it's been, but
Yes,
yeah.
Yes.
And that means the place at Franklin Street's still got people. This is
Yes.
just hotels and Ray of Light, or no?
this is everybody,
This is all-
Oh, this
this
is
is all.
everyone, not
Mhm.
just hotels.
not just hotels. No,
Okay.
this is all.
Okay, so of those, how many are in hotels, would you say?
Well, Ray of Light has
Yes, okay.
16,
Yeah.
so you can take that off.
Okay.
And then we've been averaging at Chapel House 10, 8 to 10.
Okay,
So
okay. And the
the
rest
rest
are
are in hotels.
of the
Yes,
singles, okay.
yes. And all the families are in hotels. I shouldn't say that. They're not all in hotels because we have some in transitional housing.
Right. And again, certainly, I don't want to see a family become homeless or be languishing without a permanent place to live. But the real focus is on what to do with these single individuals that are immensely expensive for the county's budget.
Yes,
The families are reimbursed state and federal at 100%.
100%. So it's.
It's the singles. Mhm.
Yeah, the biggest drain on us is the singles.
Yes, yes.
Correct.
We only get 29% reimbursement for them. So, yes.
Okay, thank you.
Any other questions?
No, thanks.
Thank you.
Okay. Warren Walsh with one resolution.
The resolution first.
Yes, please.
So this resolution is to contract with two psychologists for the competency examinations, the 7:30 examinations that we are required to do. We currently have a contract with Upstate, but it's been increasingly hard and to get a hold of them. Plus, they are pretty costly in comparison to the psychologists. So I spoke with some other DCSs in other counties, and they're pretty pleased with the two that we're gonna look to contract with for a significantly lower cost.
Okay, let's get a motion in a second. I had one.
I'll move it.
I'll second it.
Okay. Do any of your current staff do this or not anymore?
Only one. So you have to be a psychologist or a psychiatrist. You can't be a nurse practitioner.
Gotcha.
I do think things with nurse practitioners and psychiatric nurse practitioners are moving in the right direction. They are able to do more and more. Like now they can actually do sign paperwork for involuntary hospitalizations. They never could do that before. So I am hopeful that we will be able to use our nurse practitioners to do this, but as it stands now, it has to be a psychologist or a psychiatrist. So we have one contracted psychiatrist that does these for us, but you need two for every examination that you do. And sometimes you need a third if they disagree.
And these evaluations are paperwork evaluations, the individuals come in and be,
So they virtually meet with the person. They can
Virtually.
either be in jail.
Mhm.
A lot of them are in jail. So we set that up through our social worker at the jail and they do a virtual assessment. And then, or sometimes they're not in jail. So we bring them usually into the clinic. And
then
then
do it
they sit with
virtual.
someone and they do it virtually with that particular psychiatrist. Yeah.
is there any way, any capacity from Auburn Community Hospital would be interested in doing? Don't they have psychiatric staff?
Maybe they have psychiatric staff and yeah, they do. Maybe they would be interested in doing that. Yes. I can always,
Yeah, I was just
think,
curious.
honestly, the
Right.
more people available, the
Yeah.
better, because a lot of times they kind of contract work a lot
Right.
of places and sometimes they're busy, sometimes they're not, and we can't control when they come in. So we could look into that.
Because they serve the BHU or the unit, behavioral health
Yep,
unit there?
Yep.
Yeah.
Plus they
might-
have, an
might-
outpatient as well.
Yeah.
So that could be potential. Yeah. Mhm.
Okay.
I do know that psychologists are a lot less expensive.
Yes.
And they pay per evaluation, so that includes the actual assessment and then the write-up. Where I noticed, Upstate does it at an hourly rate, so they do the evaluation at a cost, and then each hour it takes them to do the write-up or review any sort of records. So that can be anywhere between
So you'd like to.
3 to 7 hours.
You'd like to see
At
it
$200
at an
an hour.
all-inclusive rate.
Yes,
If you're
so
gonna-
that's why I went in this direction because, for $350 to $400 an evaluation, I think
Yep.
that's huge. Obviously, if they have to testify, there's an additional cost
Sure.
there, but they can usually do that virtually, so we don't really have to pay for travel a lot of times. And, this is gonna be maybe half the cost is what the Upstate evaluations were costing.
Right. And these are all court ordered,
Yes.
yes.
Yep.
And I hate to ask, but,
I was gonna
Okay, go
update
ahead.
you anyways.
all right.
We have, two individuals in the hospital at this point. They went on not a 7:30, but a 5:08. I don't know if you want to vote on the resolution. before I
Yes,
go to my
right.
report.
All in favor of HH5?
Just
Maybe
because you get
Right.
confused.
Aye,
You
yes.
get confused
All right,
about the whole
yes.
7:30. So, there's two ways that we pay for forensic beds when people go to the hospital. One is through the 7:30 restoration process. When they're deemed incompetent to stand trial, they will go for restoration. There also can go through what's called a 508, which is when they are very mentally ill in our jail and the jail is unable to keep them safe or plan for them. So when they go to a hospital, the difference between a jail and a hospital is that they can do medication over objection at a hospital and they can't do that in the jail. So a lot of times that's the treatment that they're getting is obviously being put on their medications. So we have two people who really needed to go on the 508s and that they happened on April 23rd. One person went and then another individual just went on 5/8.
From
So
our jail.
yes,
And the goal is treat
Treatment.
them, get them stable and get them back.
yes. And also both of these individuals did have 7:30 evaluations done on them, which they were also deemed incompetent. So I have to communicate with OMH. So they'll do both when they're in the hospital. And then they'll restore them to a place or get them stable enough to be able to return to the jail. Hopefully, that's the plan. So,
And if you're not competent to stand trial, then the district attorney
So
or
they-
someone else takes it a different. course.
yes. Or they can go, there's other options there that we don't have to pay for. But once they're done at the hospital, they either can be restored or not. Yeah,
All right.
so those just happened.
And
Yeah, go ahead.
one last question.
Yeah.
You obviously have input as to who needs a 508 and who doesn't.
Yes. Yes.
Your mental health.
Yeah, so
center
I
and your
rely
clinicians.
on, I do rely on is the jail able to keep them safe? Because usually they have to have a one-on-one that
Mhm.
whole entire, and a lot of times if they need a 508, they still can't keep them safe even with the one-on-one, which
Mhm.
is exactly what happened in these two cases. Either the person was still continuing to hurt themselves or was at a risk of hurting the jail staff as well.
Mhm.
We do try interventions first. We really try to get the nurse practitioners to meet with them and some of them know them to get them started on medications if they voluntarily agree.
Mhm.
In these cases, I mean, they were not at
Yeah.
that place.
Okay.
So we really try everything. I think there's it's very interesting because someone can go to the hospital on a 7:30, but not meet criteria. Like I wouldn't, like for instance, I would never write a pickup order, which is when somebody is at risk on these individuals, but yet they're incompetent and have to go to a state hospital, even though I would say that they are not, like, they don't even meet medical necessity to be in a hospital for mental health. So it's this very
Yeah.
odd situation where they go to the same hospitals for restoration, even though they wouldn't necessarily, they wouldn't necessarily go to the hospital or be admitted anywhere. So it's very, from a statewide perspective, I know they're working on changing that and changing the laws, but as it stands now, that's how it goes.
Okay. Rich, did we vote on this? We had a motion?
Yes.
Okay, all right, great. I just wanted to know if you're paying attention. No, okay. All right. Do you have others?
Yeah, just a couple other things. From what I've heard, we have the SAMHSA grant, which is federal funding. It seems like the existing grants will be funded through the life of the grants. So we have 2 more years. We have year 3 and year 4 for that. So it looks like that funding should continue. It looks like, SAMHSA may dissolve. We're not really sure about that, but that they probably won't be putting any new announcements for any funding, at least for next year. So that's good news as far as the SAMHSA grant that we have. And then the state budget again looks pretty good for what we would intend. Like they have some money in there for our crisis system to be able to, not sure how that's going to look, if it's going to be RFPs or that's going to be, directly to counties for mobile crisis programs. And then there is going to be funding attached to AOT, which has never been before, for our AOT coordinator. They did not put a dollar amount attached to that yet, so we're unsure what that's going to look like as far as the money, and they are continuing the jail-based.
Do you guys know what AOT is, where you require someone to,
So it's assisted outpatient treatment. So this is when somebody has to meet a really specific criteria. I know, Rich, you probably can say the criteria better than me, but they have to have, recent hospitalizations. They have to maybe have charges. There's reason to believe that they can benefit from being on an AOT, which is,
meaning you're going to
They
get
go to court.
medication over objection?
they are not going to get.
Oh, they're not.
No.
They're going to get,
So you can't actually force someone to take medications,
okay.
unless they are in a hospital. So
Okay.
this is people that on the AOT order are required to take their medications, but that doesn't always mean that's what happens. But there are other mechanisms to be able to get them into a hospital if they aren't going to take their medications or follow through to the recommendations of the AOT.
So
Does
that,
that pretty much summarize?
Yeah, it's for people who are not voluntarily,
Yeah.
voluntarily treating themselves essentially, and they're a danger to either themselves or others. So they're on,
so the court says you must do it, but you really can't force them.
you
to do it.
handcuff them and,
Mhm.
put the pill in their mouth, but
Correct.
Yes, okay.
there is a court order, and then if they refuse to take their medications, then you go through an additional legal process where you compel them to go to
Hospital?
the hospital, they're evaluated, and the hospital physicians determine whether or not they should stay under the 508.
Gotcha.
So it's,
Yeah, it's
Not as easy as.
So there's specific, statute that says, you can do a pickup order for someone who's on an AOT that isn't taking their medications or following, like they're not going to substance use treatment if that's part of the AOT, or they're not going to outpatient treatment, they're not meeting with their case manager. So if they're not following those things, you can do it's a different type of pickup order, but it's still treated the same exact way when they get to the hospital. If they go to the hospital and the ER, examines them and says they don't require admission, then they're still going to be in the same boat. So
Mhm.
some people it works very well on and they do very well and they stay on their medications and it's very valuable. And then there's other people that maybe don't necessarily benefit from it either. So there's a huge investigation process to it. So we have one of our supervisors that is our coordinator for us. So this is good news that there will be some funding because that's all, time that we aren't able to get kind of reimbursed for.
Mhm.
And then the other piece is they are going to continue the jail-based substance use plans and the medication assisted treatment funding. So we have state aid funding that goes to the jail to provide substance use services as well as for the cost of medications. There was new money that is a direct contract. It's not coming in state aid, but it's a direct contract between Oasis and Farnham. So Farnham is our OTP, which means they do the methadone treatment and they do the methadone treatment for the jail. So there is an additional $66,000 that's going to go directly to Farnham for Cayuga County Jail to be able to pay for specifically the medication assisted treatment for substance use.
That otherwise would have to come out of the jail's
Correct,
budget.
correct. Now, we don't know, I don't know that would cover all of it, but it's still
Right.
better than what was before. I think that came from, the
Didn't we have
jail.
like $100,000 a long time
Yes.
ago?
So we do still have that's state aid that we
Okay.
give for the jail and they use it for, they're required.
This is in addition to that.
Yes, yep. So Farnham's right here in Auburn now, so it's easy for them to transport the methadone back and forth. Yeah, and that's mandated, so. And that's all I have for
Okay,
now.
just my curious question. Is there a significant number of people incarcerated receiving these services?
As far as the substance use services?
Yep.
Yeah, I'm not sure. I think it fluctuates. We'd have to ask the jail for specific numbers, but it really depends on the population at the jail.
Yep.
Sometimes it could
Good time.
probably be higher and lower depending on who's there.
Mhm.
But I think there's a pretty good amount of people that are benefiting from that in the jail. So.
Thank you. You're welcome. Brenda, you don't have any resolutions, but certainly you would like to update the committee? Sure.
So I just want to start out with the good news regarding the state budget. The Office for the Aging, New York State received the highest increase they've received in historically. It's $45 million that will be filtered down to the different local to county Office for the Aging. One of the good things about this funding is it is 100% funding, so there's no county match, which the state has been, our New York State Office for the Aging and advocates have been working to emphasize how important that is, so that the county doesn't have to put in order for us to gain the money. So I wanted to mention that. We did a recent outreach in Sterling and Summerhill. Definitely in Summerhill, we made some important contacts. We do have to really look at this though, as far as our outreach efforts. It's something that we started 3 or 4 years ago when we were able to add an additional staff person. With the numbers being as low as they are, it may not be the best use of our staff time. So we're going to reconsider and look at other ways to do that. We do have, I'm going down the report, we do have aging services specialist vacancy due to one of our staff members moving out of the county. Her and her husband have moved to the family dairy farm, so it's kind of nice that they're able to do that, but hard for us. I want to mention that we celebrated the volunteer week with the volunteers that do our meals. We have 85 volunteers that deliver the meals. We were able to obtain donations of coffee, cookies, some raffle items, and some freebies to give away. We put up all our, we love our volunteer signage and different things, and they really appreciated that. And try to let them know that they have a huge benefit for the seniors in this county. At this point, we believe the farmers market coupons are still going to be distributed. We haven't heard otherwise. I'll know a little bit more tomorrow when we have a call coming in. And our caregivers forum today on the 14th was very successful at the library. This was a collaboration with the Alzheimer's Association. We had 21 caregivers attend, which is pretty good. And that's kind of, as I mentioned at our last meeting, that we will have our Senior Citizen of the Year recognition at this legislative meeting on the 27th. So we have 3 people to recognize this year.
Okay. Any questions for Brenda?
No.
No, thank you.
Okay.
Deb, sorry, you should have gone first because you're the only one that goes to 2 committees.
Selling to.
Two committees.
It's fine because I'm having to do all the stuff at home.
Being last for.
Yeah, that's right.
I obviously don't have any resolutions, a few updates to my report. I just wanted to once again mention that on May 3rd, I did attend the Spring into STEM event at the new Workforce Development Center. That is a program that the Youth Bureau was able to use some ARPA money. We had given them $10,000 to use for that program, which was very successful in all of the schools in the area. This particular event was held right at the Workforce Development Center. It was open to the public. And Booker T. Washington actually bused students from their after-school program there. And there was about 90 students there that were able to try different STEM type career ideas. And they had food donated from Nucor and CCC's culinary team. So it was a really great collaborative event. I think the children really seemed to enjoy it. So it's a great location too. And then speaking of ARPA, another program that we had helped fund was the Hideout Gaming Center, and they're getting ready actually to do a grand opening at 100 Genesee Street. They're actually going to be in the Genesee Street Mall, which that location will be really convenient for a lot of the kids in the area. And one thing they're doing this summer is they are doing a Hideout Gamers summer camp. So that's a 2-week camp. That's going to be $65 for the full 2 weeks from like 10 to 3. So they're trying to do a lot of things this summer for kids in the area. Again, always looking for things to do. Part of the reason I am working with United Way and Chad is to try to come up with things for kids to do this summer. That seems to be one thing I get a lot of calls on is what is there to do? What is there to do? So we're hoping to collaborate and put something together for this summer for ideas for youth to give them things to do.
You gave some ARPA money for this startup, and then they're sustaining it without it at this point?
Yep. mhm.
Great.
Yep, because they've been at the Clark Street Road location. I know they get a lot of field trips that go there, but I don't think they get a lot of foot traffic because of the location. I mean, that's out by the mall, so that's not
Yeah.
really, so they're hoping this will really drive a lot more participation. Some provisions of interest. I know everyone's been talking about the state budget. So for the Youth Bureau specifically, the Youth Development Program is receiving $6 million more than last year, and Youth Sports and Education, 7.5 million more than last year. So obviously that will be split up amongst the counties, but that in turn hopefully is going to give Cayuga County more funding to do these programs. So that's exciting. Hopefully we'll hear what the allotment is for that in the next couple of months, so we can get the 26 applications out to groups. And one other thing is, I know people have been talking about moves, and I'm actually my office, so as Youth Bureau Director and the Stop DWI Coordinator, my new workspace, because I have primarily been remote, as I'm moving to the college and one of the cubicles there where workforce development used to be. So I'll be planning to make that move next week.
Great. All right.
That's all I have. If you have
All
any
right.
questions.
Okay. All right. Thank you very much. Okay, I guess. Unless motion to adjourn? Second? All right, great. Thank you. Well, not 5 minutes.